Floss Bands today with Dr. Holliday, Spine Sport Therapy here in Winnipeg. So what we're going to be doing is talking about how this works, why this works, and we're going to show an application of how to do a floss band on a bicep or on an elbow joint. So I guess the principle behind this floss band is that to increase mobility within tissue, you want to apply compression, tension, and movement. That is what's going to increase the tissue's ability to slide over one another and ideally increase the mobility of that particular joint or that tissue, right? So that's what we're going to be looking at today. So when we apply the compression is not enough simply because we need to have tension and movement so that the fibrous tissue between the skin is going to have the ability to glide more freely. So compression alone is not enough.
For sure, yeah. Think of it as just layers of tissue, talking about skin, fascia, subcutaneous fat, there's blood vessels in there. Everything's layered. So when we talk about movement around corners and tissue, the outer layers are going to have to move more around the corner. So if we can provide some compression and pushing down, then we're sort of shearing these tissues apart. And when that happens, we're going to get more mobility through those tissues. When we incorporate it around the joint, like DJ said, what we're doing is we're essentially going to be squeezing that joint. So if we have two bony surfaces that are together and I put compression on them, essentially I'm going to be squeezing them apart so that when I do some ranges of motion, I should be able to free up any restrictions that I'm feeling in that range of motion. So it's good for soft tissue for joint. Like he said, we're still trying to figure out the best way to describe how this works. But so I think we're going to wrap an elbow here, and DJ has an issue with a range of motion here from a torn bicep tendon, right? Yeah. So let's just maybe demonstrate what's going on with your elbow here a little bit. So both hands out in front. So let's do that. So he had a tear in his bicep tendon. It's been reattached just below the elbow here. So there's going to be an issue with a few of his ranges of motion, mostly the supination, just not quite there. Passively we can get it there. That doesn't cause any discomfort though. Yeah. Go arms straight out in front like that. So the extension's actually pretty good. He said he's done a lot of work to improve that since the injury. So the extension's not too bad. But when we wrap this, what we're going to try and focus on is improving maybe his extension and then his supination just a little bit more so he can actively do that, okay? So we're going to wrap from about mid-forearm to just up into the bicep here as well, causing that joint distraction in the elbow, specifically where the radial head is here hitting the humerus, and that's hopefully is maybe going to free up a little bit of that supination position there as well, okay? So, we good to wrap this?
Yeah.
So when we wrap this with this blend, this is just a really thick band. It's thicker than a TheraBand that we would use for rehab exercise. There's a couple things we want to be aware of. We want to just check the tension of it. We don't want to go with 100% compression with this band. We'll probably back off to about 50. A few things we want to watch for: discoloration in his hand. So if you look at it now, it's probably just nice pinkish color. It's probably going to change a little bit. We're going to cut the blood flow off just a little bit. We certainly don't want to get any pins and needles. If you're starting to feel that, then we'll get it off. Okay. So we're just going to keep you in that position right there, and then as we wrap this, so we'll just do one lap around to tack it down. So about a 50% pull here, and I'm just overlapping by about 50% with the band as well.
One of the things you want to do if you're trying this yourself, there's a couple of safety things. Never wrap your neck, abdomen, face, all these sorts of things too. It's like you should first go to a professional and get them to show you how to do it before you try it yourself, because you can cause yourself some damage, or else you might just do it improperly and not get the result you're looking for either.
And then just at the end, a bit of slack in the guy and tuck it underneath here. How does that feel?
Feels good.
Pretty tight. So we'll just get you to go in that extended position there. So straighten those arms out. Feel some compression in that whole area through there. Good. Okay. So we can have him do just some active movements to start. So he can work on his pronation, right, and supination. Good.
definitely a restriction on the supination. You'll feel it where they put that tack.
Yeah.
You feel it grabbing there for sure.
So he does have some hardware in there holding that bicep tendon down. So he says he can feel that restriction in that area. That's okay as long as he's not hurting himself doing it. We'll go into some flexion and extension patterns with the elbow too. So we'll have to go right up. Good. And then extending. Good. Now he didn't have a real extension issue. He was pretty straight there. Lots of people do have that extension issue.
It's a supination, and also like when I'll extend my elbow and supinate, that's when you're gonna feel a pinch like right at the spot where that was attached.
So we can maybe make that a little more aggressive, so we'll go down onto the floor, sort of like some of the wrist mobility work that we had done before. So we'll get into that pattern there. Good. How do you feel there?
You know what, it doesn't, it's definitely pain-free, but it's definitely, you feel the compression, and there's tons of tension on there right now.
Yeah. So when he does that, so he's actually accentuating that pattern again. So he's accentuating that supination pattern because he's rolling his arm inward, right? Mm-hmm. And that wrist is staying fixed. So you're really accentuating that supination pattern. The pronation pattern would be to come into that position with the wrist. What do you feel?
I feel like, you know what, when we got down here just a couple moments ago, it was pretty tight. Now you can just, maybe I'm just getting more familiar with the amount of tension on there and a little more comfortable.
Yep.
But yeah, there's definitely an improved ability to do that.
So how's the fingers doing? Okay.
Yeah, fingers are good.
We're losing some color there, so we'll be quick. But when he's in that downward position, he's pushing, so he's got more force going through that joint. So the opposite of that would be for us to put some distraction into that now. So we'll head over here to the post, and we'll let him grab onto the band here. So he's gonna grab that band. Yep, grab that, and then go down on one knee. So now we're gonna get some distraction through the wrist and elbow, and from here he can work on those patterns again. So we can go into that pronation pattern there, good, and then go into that supination pattern. Good. How's that tension in there?
Pronounced.
Yeah, good.
Yeah, definitely.
So again, compression of those tissues, distracting the joint, gliding the soft tissues of the bicep, of course tricep, and then the forearm musculature in here, including the supinator, extensors, all those groups in there.
Yeah, because that supinator, you could feel that there was definitely a lot of pain because it was taken over for so long,
Yeah.
because the biceps didn't have it. But I could still, obviously, you still have supination power, but I mean, only about 40% is done by your supinator, like 60 is done by the biceps.
Yeah.
So it's like definitely overworking.
Good, let's get that off. He's getting probably a little discolored here. You're going to see. We'll
Yeah.
hold the both hands together there. So once we start to get there, we probably want to get that off.
Yeah, if you see this, remove it. There you go.
Hold that arm up there. There we go. Perfect. Good. So just give it a good shake and see how it feels. So there's your active range again. How do you feel? What happens if we just supinate that a bit more?
I'm saying it's pretty close.
It's pretty close. And then if you go straight out front and try that supination.
And this is the first time I've ever done this either. So I thought on the biceps anyway.
How's that feeling there?
Feels good.
Yeah. How's the whole forearm feel? The elbow?
Feels warm, obviously, because now there's increased blood flow. Because essentially what we've done is we've done a bunch of contractions with restricted blood flow, so the blood is going to rush into this area here too, right? That's why you're going to feel it warm. It's going to turn red. These are all, I would say, for me, normal feelings after having done this before for ankle and also my thigh. But yeah, so I mean, this is all normal feelings. It's going to be increased temperature. Obviously, you've seen the swelling in the hands gone down too. And I mean, that's now looking pretty good.
Yeah.
Oh, that's good. So yeah, like we said, we're going to be doing more of these videos on the floss.
Yeah,
for sure.
Yep.
And just to let you know how you can do it, but it's always good. Like, I'm here with Dr. Holliday. He's a professional. He's shown me how to do it. So always seek the advice of someone that knows. that's the best way to avoid further injury, or to also make sure that you do it correct.
Yeah.
Right. So.
And just introducing a new tool, a new apparatus to use, something to help with mobility. I think it's very effective, but there definitely are a few things to watch for.
Yeah.
So just exercise a little bit of caution when using a floss band. And if you need some help figuring out how to use it, we'll help you.
Yeah, get in touch with us for sure. Like I said, with mobility, it's about compression, tension, and movement, right? So this, if we were just going to wrap this by itself, it's not going to do too much.
Yeah.
It's going to give it compression and tension, but then once we start to move it, that's when we're going to start to increase the tissue's ability to glide over one another, and hopefully start to have some, I guess unless it's a very severe case, but some increased mobility, because as you can see, I mean, this is just one session, right? So yeah, it's pretty good. I'd say so.
Great.
Yeah.
Perfect.
Thanks very much.
Good.
Thank you very much for watching. If you got some feedback, leave it in the comments. If not, just shoot us a message. Have a great weekend.
Yeah.
Thank you, sir.
Thanks. Appreciate
All
it.
right.